I just want to say thank you all for being here. I hope you enjoyed the sessions yesterday and the warm welcome from Mayor Watson. I also hope you all got to maybe see the Austin Bats, which are just 2 blocks down the street here. They live under the South Congress Bridge. It's just something special about this city, and so please enjoy it while you're here. As you might have figured out, we have put together a conference program of what we believe showcases the heart of HEI, which is not only highlighting the most rigorous, transparent, impartial science, but also how public-private partnerships are at the center of what drives that science forward. As you all know, we have been working for more than a year, and our staff, especially under the direction of Dr. Ellen Mantis, our Director of Science, has spent an enormous amount of time putting together our 2025 to 2030 strategic plan. That plan was informed by conversations with all of you. And we hope that it reflects the priorities that you all see as essential and critical to help support the work and the missions that you have within your own organizations. So we have spent a lot of time really dialing in and trying to focus on the highest priority areas of research. And, you know, one thing about HEI is that we are doing science for purpose, right? Society benefits from the science that HEI is supporting and is funding. And I'll just give a couple of examples. Within the core transportation work, for example, thinking about the systematic review of traffic-related air pollution, that's probably one of our most downloaded resources on our website, and it has literally informed air quality policies around the world. So it's got a lot of impact. The time and effort that all of you have spent either doing the work, serving on committees, reviewing the work, writing the reports. All of that matters and how it's used to benefit society. We were just in Colorado, the Energy Committee, and you heard conversations around New Mexico and Colorado officials thinking about 2,000-foot setback distances from oil and gas operations. Is that enough? What are the science? What are the data that help inform policies like that? And it's data that HEI has funded and supported and presented and communicated that informs all of those conversations. Thinking about the global work, just at the World Health Organization second air quality summit last month, Minister of Environment from China, in his slides, holding up the SOGA report that Dr. Pallavi Pant put together, the Asia report. This work is being used across the world, making decisions that impact every one of our lives. And then, I also want to call out our Cherry program, thinking about accountability. You heard Mayor Watson talking yesterday. We need to know if these policies work, right? It matters to cities. It matters to governments how much we invest in these policies and programs, and what do we get? Are we getting the return on investment that we think we are? So I think I hope that over the course of the next 2 days, you have an opportunity to really get into the heart of the science. We have over 90 posters over the course of the conference. That is really amazing work that you all have contributed to and are showcasing here. I also want to give a call out. This is a very special year for us. As you know, we're lucky to have some air titans here, Dr. Doug Dockery and Dr. Arden Pope. As you know, they've released their book, Particles of Truth. It's both a chronicle and a celebration of the progress we've made in understanding particulate pollution and its effects on human health. And no surprise that it features the work of many of you, that many of you have done over the course of the years. Actually, I know Sarah Dar is out there somewhere and actually has pictures of people pointing to their names in the book where they're referenced. So, this is meaningful work that helps and benefits each of us. Um, you know, uh, Doug Dockery and Arden Pope's work, the iconic six city studies, it didn't just change science, it changed regulation. It changed air quality standards. It saved lives. And this book reminds us of something central to HEI's own DNA, which is that we follow the evidence wherever it leads, and we ensure that the science is heard where it matters most. So if you don't leave this conference with anything, please leave with that little nugget that the science that we are doing is impartial, it's transparent, and it is not, it's apolitical, right? The science is the science. So with that, I'd like to welcome Dr. Doug Dockery up, and he's going to give us a little bit of a look back. Thank you.
Well, that was quite an introduction. I have a lot to live up to here, up to. So today, well, first I want to thank Elena for the hospitality and arranging this meeting, and especially for organizing the baths last night. That was stupendous. I want to give you a little history and context for the work we've been doing over the past 30 years, and actually reflecting back on the HEI reanalysis project, which was released 25 years ago. And it's an appropriate time to think back on what the legacy of that has been. So on July 26th of 2000, almost exactly 25 years ago, Arden and I went down to the American Academy of Arts and Sciences in Washington, D.C. for a press conference that had been organized by Dan O'Keefe and Dan Greenbaum of HEI to present the results of the reanalysis of the six-city study and the American Cancer Society study. This was going back over research that we had done over the past 2 decades and doing a deep audit, a deep reanalysis. And we were not aware of what the results of that were going to be. We were waiting to hear. And how do we get into this position? Well, interestingly, if you go back exactly 3 years before that, in July of 1997, the US EPA had promulgated a new standard for particulate matter and specifically identified PM 2.5 as a new criteria pollutant and established a standard for an annual mean and a 24-hour standard. And this portended to be the biggest controversy in terms of environmental regulation for the decade of the 90s, and really started a very strong pushback by scientists. Industry and environmental researchers started squaring off over the studies, and specifically, the opponents of this wanted to frame this in terms of a small number of studies. And in fact, they identified 4 studies, the Utah Valley study, which Arden had done in hospital admissions associated with particles, the Philadelphia daily mortality study, which Joel Schwartz and I had published, the Harvard Six City study, and the American Cancer Society study. So in March of 1992, Joel Schwartz and I had published this analysis of daily mortality and air pollution and particulate air pollution using TSP, which was the standard at that time, from publicly available data in Philadelphia. And it showed this remarkable, potentially near linear association between daily numbers of deaths and TSP concentrations in Philadelphia. And what was remarkable or most important about this was it was suggesting that we could see deaths, clearly an adverse health effect, at concentrations far below the existing air quality standard that had been set to protect the public health. The standard at that time was 260 micrograms per cubic meter. And you can see the evidence is clear that we had effects below that. And in 1993, we published the follow-up of 8,000 adults in 6 cities across the United States who we've been following for up to 16 years, and showed that myself and Arden and Frank Spicer and the rest of our colleagues at Harvard showed that as increased levels of fine particulates, specifically PM 2.5, we saw increased mortality or increased early death in this population. And again, suggests, and all these communities, as before, were meeting the current standards, again, suggesting that there was evidence that the standards were inadequate. And this was followed up a little over a year later by a confirming study led by Arden Pope and Michael Toon, along with myself and Frank and other investigators, looking at 295,000 adults living in 50 communities in this cohort that had been built up and followed for 8 years by the American Cancer Society, which showed again that mortality rates increased in proportion to the fine particulate, the PM 2.5 at that time. So these studies were very important in defining the potential risk and were key in setting the standards. And the response from the business community, here illustrated in this publication from Business Week, was tiny particles, big dilemma. The air pollution data aren't clear, so should EPA be making rules based on this, challenging the data, and in fact, starting to challenge individual investigators. So this is not to say there weren't legitimate concerns about the basis for these data. Roger McClellan, who was on the research committee at HEI at that time, and Fred Miller published a commentary noting that the human data from epidemiologic and clinical studies are usually the primary basis for setting environmental or national ambient air quality standards. And the data from animal studies and in vitro studies are often used in the supporting role. And what they were most concerned was that the substantial evidence used in the new PM standard was drawn from drawn exclusively from epidemiologic data. And there was a troubling concern to the extent that other data did not provide support for those proposed standards. There was really no clinical data, there was no in vitro data, no animal studies supporting this. And in fact, Congress recognized this also and called on the National Research Council to do a whole review of the EPA PM research program. They formed a committee headed by John Samet, and that committee was charged with identifying research priorities for EPA, to look at the particle standard, to develop a research plan for EPA, and to monitor that program over the next 5 years. And in fact, one of the major recommendations of that committee was that need to be much more research in terms of the mechanisms of the observed health effects in the epidemiologic studies. So traditionally, when you have a paradigm-changing study like this, the Philadelphia mortality study, the response is you publish this, and then other people look at this, and then they try and go out and reproduce the results, and they publish that, and then there's, over time, a back and forth. And in this case, Suresh Mugavkar and his colleagues went and got the same data, the publicly available mortality data from Philadelphia and the publicly available air pollution data and the weather data, and did the same and tried to do the same analysis, but they claimed they could not find the same results. They could not attribute the increased mortality to PM or to TSP at that time, to particles. And there were generally concerns that had been raised about these time series studies, that the methods were new. Time series analysis was new to the field. There were questions about the data, whether they were really true, whether it was invalid. There were a lot of questions about whether this was some weather phenomena and not really an air pollution phenomena, and whether this is really a significant effect on death, whether people were just, these were frail people who were on the verge of dying and their date of death was just advanced by a day or so, what we would call harvesting or mortality displacement. So there was a controversy that had developed around these types of studies. And the Health Effects Institute, under Dan Greenbaum and Aaron Cohen at that time, organized this particle epidemiology evaluation project to provide an impartial, rigorous, and timely evaluation of these key studies and assess the validity of these results, and in fact, to provide a extended and more detailed understanding of the associations. So in July of 1994, they established an oversight committee and they did an international competition for a team to reanalyze the data. And ultimately, a group headed by John Samet and Scott Ziegler was chosen from Johns Hopkins to do the reanalysis and evaluation. And Joel, myself, Arden, and Suresh all agreed to turn over our data to this group. And they actually very efficiently undertook this project. And within a year of being formed in July of 1994, in August of 1995, submitted their first report and their phase 1 analysis. They reported, agreed with those of the original investigators that daily mortality, all-cause daily mortality, cardiovascular, and respiratory mortality were all associated with particulate air pollution. And this was followed up by the phase 2 report, which found that, in fact, these associations that were observed in Philadelphia could not be explained by other known factors, including weather or other pollutants. So this was in March of 1997. And notice this is just a few months before EPA promulgated the standard in June. Was that June? Yes, June of 1997. So this was a very important confirmation of these acute mortality effects and also really had major influence. But the response then was, well, what about the other studies? What about the Six Cities study and the American Cancer Society study? People began to demand access to the raw data from those studies. Now, this is a very different type of forum. Here when we recruited participants into these studies, we assured them that we would not reveal their individual data to anyone outside of the study, much less to the public. And here we had interest groups like the Citizens for Sound Economy demanding that EPA release the data and actually publicly release the raw data, the individually identifiable data that was the basis for these studies. And we rejected that hypothesis. Nevertheless, this led to a very public debate. And in fact, the opponents of this were trying to frame this that we were somehow hiding the data, that it was secret data, and we changed the debate became a debate about secret data, as reported here in the Wall Street Journal. And ultimately, or very soon thereafter, in fact, this is reported in Science just actually the same week as the promulgation of the standard, lawmakers jumped into the debate. And in fact, a House committee directed the Environmental Protection Agency to publicly release all the raw data from these air pollution studies. So we were really getting beaten up about this and trying to figure out what to do. And we said, well, uh, Jim Ware, who was dean of the School of Public Health at that time, who was also a co-author on the Six Cities paper, and Michael Toon, who was the science director at the American Cancer Society, said, let's turn to HEI. And we approached Dan and Bob O'Keefe and said, can you help us out here? Can you help us address this controversy and organize an independent reanalysis of the data from these cohort studies, with the caveat that you can do whatever you want with this, but you have to maintain the confidentiality of the participants in the study. And so we agreed to provide access to the data and all the original records to a team of analysts that would be selected by HEI through a competitive process with that assurance of confidentiality. And HEI set up a expert panel that was headed by Arthur Upton as the chair, consisting of 8 members. Aaron Cohen was the research project manager. In July of 1995, so this is a month after the standard had been promulgated, they put out a request for qualifications. They did an international search and ultimately identified a reanalysis team based at the University of Ottawa, headed by Dan Kruski and Rick Burnett and Mark Goldberg at McGill, and 28 other investigators across Canada and the United States. It was an impressive team that had been put together. And the original investigators were identified as myself and Arden and Frank Spicer and Michael Toon and we discussed the problem. We worked with the investigators, the reanalysis team, to understand the data, to understand the analysis that had been going on, and worked with them. They had over the next year, they had a series of public meetings where they would discuss potential problems with the analysis and welcome public comment, and developed a research plan that they presented to the expert panel in November of 1998, and then went off and did an audit of the original data, tried to replicate the original analyses, and then exercise the analyses to see whether they could come up with alternative explanations. And in fact, we did not hear again from them for another 2 years. And so this was in July of 97. It was 3 years later, in July of 2000, that we had this press conference where we went down to hear the results. And as you can see from the headline here, the new analysis confirms the results of the key studies of particulates, particles, and mortality. And picking up on some of the quotes from this, an extensive quality assurance, quality control audit of the data revealed it to be generally high quality. Kruski and colleagues were able to replicate the original results, and the reanalysis team tested the original results extensively against a range of alternative variables and analytic models without substantively altering the original findings. And at the same time, they released the full report, 303 pages, which included a reprint of our original papers, which were 14 pages total. So this was a massive effort, highly detailed. And I mean, Arden and I commented on this actually at the time, that we somehow felt the data was being bludgeoned until it succumbed to their wishes. Although we did comment that they had done this very systematically. and it was a very impressive effort. In reporting this, the next week in Science magazine, Jocelyn Kaiser reported that the nonpartisan research group had reevaluated the key data that EPA had used in setting the PM 2.5 standard and had come down firmly behind the agency. John Vandenberg was quoted as saying, "The reanalysis puts to bed the many concerns that were raised 3 years ago." But this did not answer all the questions, certainly. But it's interesting. I mean, this was really going back and answering questions that had been raised 3 years ago. And in the meantime, science was moving on. And in fact, when you look at these two documents, which were critical in the debate that HEI had funded, these reanalysis projects, reanalysis of existing data really is not validation. You're just looking at the same material, and hopefully if you reanalyze it, you'll get the same result again. And if you're going to get real validation, you need to do independent analyses by independent investigators in independent populations. So you need to extend this beyond just fighting about these individual studies. And in fact, HEI took this on for the daily mortality. They engaged actually the original team of investigators in a national morbidity and mortality air pollution study, which looked at the PM 2.5 daily concentrations and the associations with daily morbidity, that is hospital admissions, and daily mortality, and extended that to the 20 largest cities in the US and ultimately to the 90 largest cities in the United States. So expanding this into many, many other populations. And interestingly, they published this result in June 2000. So if you think back, that is actually a month before the reanalysis came out. So we've got a body of evidence developing very quickly here. And then they extended that analysis under the leadership of John Salmon and Clea Katsiani with a very distinguished international set of investigators in the AFENA project to take the data from those 90 cities and merge that with data from 24 European cities, along with 12 Canadian cities, to extend this internationally. And really, I think in a particularly important contribution, extended this in terms of capacity building and providing policy relevant research and capacity to Asia in the PAPA project, where they coordinated investigations by local investigators in 8 different Asian cities between 2010 and 2012 as a really outstanding model of capacity building around the world. At the same time, they were extending the work of the American Cancer Society study, funding that team to continue analysis of that data, extending the follow-up, doing a more extensive analysis of the exposures, but most importantly, providing much more detail in terms of the pathways of the effects of acute mortality, or chronic mortality, rather. And so this has continued to be a major source of information moving forward. But again, this is still looking at the same cohort. And if you're going to do real replication of these chronic studies, then we have to look at independent cohorts. And this is actually out of our book, a table showing up at the top, the 6-city study and the American Cancer Society study showing the effects of 10 micrograms per cubic meter of PM 2.5. But importantly, then 9 additional studies cohort studies from the US, from Europe, from Asia that have replicated these results in different populations, different investigators around the world. And you can see that very consistently show about a 9% increase in total mortality and about an 11% increase in cardiovascular and cardiopulmonary mortality associated with PM 2.5. So this is the type of evidence that really is necessary if you're going to confirm and validate the Six City study and the American Cancer Society study. So we now have a very strong body of evidence of what the effects of PM 2.5 have been in the population and a strong basis for standard setting. So what has been the reaction by the politicians and the lawmakers? Well, in 1998, Senator Richard Shelby introduced snuck in actually an amendment to the 1999 Omnibus Spending Bill, which said OMB need to make all data produced by federal awards to nonprofit institutions, that is to universities, available through Freedom of Information request. That is a backdoor way to make all the data that we were collecting available under Freedom of Information. In 2014, Congressman Lamar Smith, who represents Austin and San Antonio. I don't think he's here, is he? But he introduced legislation called the Secret Science Reform Act in 2014 and 15, and then subsequently the Honest Act for honest and open new EPA science treatment, which would have prohibited EPA from using studies from any policy purposes unless data were publicly available. In 2016, Andrew Wheeler proposed a new rule for strengthening transparency in regulatory science, which would prohibit EPA from using any study that did not make its underlying data publicly available and validated by EPA review. So it's interesting, in the face of this developing body of science, they're still looking back to 1997 and trying to use whatever methods they can to actually undermine epidemiology and demand release of data. So, it's still a focus now, decades later, looking back to those original secret science arguments. Contrast that to the HEI mission, which was just released last week, which is based on impartial science to inform decisions through policy relevant scientific research, to convening independent experts to oversee that research, to bringing together all the interest groups to guide research priorities, to synthesizing, interpreting, and communicating the scientific evidence, and to be a mechanism for helping people translate the science for decision making. I mean, this is something I think we can be very proud of, as opposed to what's been proposed by the lawmakers. So, this story is actually part of our book, which Elena has kindly highlighted for us. Arden Pope and I published this. It was released on April 1st and is available. We have a few copies left that we can make available after this session. It tells a story, but also the larger story of how we discovered the effects of particles, the controversies that have been involved in that, and the whole fight for healthy air. And in particular, I want to highlight the work of Dan Greenbaum, who was director of HEI, and as you've seen, was a key member or a key participant in this discussion. Dan was director or president for 30 years during this whole process. And when we submitted our final manuscript to MIT Press in January of 2024, we sent a copy to Dan, and he read it and got back to us. And he said, "How nice to hear from you both. And congratulations on getting your book and the PM story published. It's a great story about science actually informing public health." We were very gratified to get this in January of 2024, and very sad when Dan passed away actually a few weeks later. But we want to thank Dan. We want to thank HEI. We want to thank our colleagues, many of are here, for being part of this story. And thank you for your attention.
We have time for a question. Okay. Thank you all. We have time for just a question or two if anyone has a question. Ooh, Martha. Okay.
Thank you so much for being here. This is really quite a remarkable story. I am currently a board member of HEI. I am not a scientist. I am a lawyer. And my question to you is, given the attempts by our Congress to change how we do science, basically, by trying to get the raw data out. Back in 2017, when the regulation was proposed, I was involved in reading Harvard's response to that, HEI's response to that, and making arguments against it. My question to you is, what do we do now in anticipation of that proposal coming back and wanting science to reveal the raw data so that these studies can be, I'll say, replicated? How do we fight that?
I don't know. It's very discouraging to see the current state that there is this attack on science in general. And in the past couple of months, we've seen, first of all, that all the scientists have been dismissed from the Clean Air Science Advisory Committee and the Science Advisory Board. We've seen scientists being dismissed by EPA who've been working on this. We've seen funding being cut off for the STAR programs. There was an email that went out that was actually cut off support for HEI and all the work that's being done. We've seen at Harvard, we've seen the challenges, although there actually hasn't been a direct elimination funding yet on our air pollution work. And actually, I think most disturbing to me was the announcement last week from Joel Kaufman that Environmental Health Perspectives, the premier journal for environmental health research, was not able to take new science input or new publication submissions because of cutoff of funding there. And I mean, we're going to be talking this afternoon with Dave Peden about the challenges to the human exposure study. I mean, it's across the board. And, you know, at least we've developed this very strong record and, you know, have gone through the processes of developing this. I mean, working with Gina McCarthy, I mean, she always used to say, you know, there's procedures that have been established to establish these standards. And likewise, if you're going to go back on these standards, you have to go through these procedures, which take many years. But we see the current administration is just throwing all the procedures away. And hopefully we can turn to the lawyers who are going to be able to at least make the government follow the procedures that have been established and follow the science. As Elena said, I mean, our mantra has always been follow the evidence and follow the data where it leads you. And, you know, I'm very discouraged, but hopefully we can survive this onslaught.
Great, thank you.
Okay.
I'll sit.
Yeah. So I think we'll move on to the next session.
So I'm Ellen Mantis. I'm the Director of Science and oversee the Environment and Health Program. It's been a busy, just lose the slides. Thank you. It's been a busy past year, and I'm just going to provide a couple of highlights from the year. We were wrapping up our strategic plan 2020 to 2025. Just as a reminder, themes for that strategic plan were accountability, complex questions for the air pollution mixture, transport and urban health, and global health. And Pallavi Pant will be talking more about the global health area. It was very interesting last night to hear the mayor of Austin talk about 3 accountability studies of ours and how useful they are. One of which was the study by Sarah Dar looking at the retrofit or replacement of diesel school buses and performance, looking at school attendance and performance, and also Amir Hakami's study looking at the quantifying health benefits of, actually, there's a technical problem here. Could someone, the slides are not showing up. Thank you. As I said, the second study was by Amir Hakami, looking at quantifying health benefits associated with emission reductions in 2 sectors, transportation and energy generation. And Perry Heisted mentioned his study yesterday that was looking at and evaluating effects of birth outcomes given policies in Texas to curb transportation emissions. And coming soon, I feel like this is the movie trailer here. We have 2 studies finishing up in China, looking at policies there to reduce emissions. Those are in either review or in the publication stage. And another study that literally just entered review a day ago that's looking at policies targeting mobile emissions and electricity generating units and calculating health benefits and comparing those in U.S. cities. And a 4th study that's developing fine scale metrics for evaluating changes in fine particulate matter for major sources and fuel categories. And that study will be wrapping up this year as well. And you'll be hearing more about accountability studies from Anna Rosowski, the lead of our CHERI program. So the other area, complex questions for the air pollution mixture, I'm going to do an ad for a session at 1:30. Go to that session for learning more about the enhanced exposure assessment studies. There were 5 studies here. So check out that session to hear the great results and research that was done for that program. We published 2 reports having to do with COVID, air pollution, and health. One by Catherine Tone, another Kai Chen. One was talked about last year by Zorana Anderson, and we have 2 others coming soon. And then we have 2 studies entering review this year that are investigating the influence of biomass burning and the influence of various health effects. So lots going on there. Transport and urban health, the main focus for this program. I mentioned last year, several studies were being initiated. They are well underway now. One is creating a framework for full chain assessment of transportation systems and the effects of TRAP on population health. Another looking and examining the association of TRAP with lipids and other biomarkers to explore pathways that might mediate cardiovascular disease risk. A third, assessing impacts of future urban transportation landscapes on cardiometabolic health using agent-based models and other models. And finally, a fourth study developing models for characterizing exposure to different modes of transportation, vehicle, rail, aircraft, and relating those exposures to birth outcomes. 2 studies on research on non-tailpipe emissions. One is in review, actually, a study being done in the UK that was looking at short-term respiratory health effects of adults with mild to moderate asthma, looking and having them exercise in different locations. One location representing brake wear, another representing tire wear, and a third for a control location. And that study, as I said, is currently in review. And a second study that's providing real-world field measurements to estimate and understand population exposure to non-tailpipe versus tailpipe particulate matter. And last year, we were just getting started with a special project, a heavy-duty diesel vehicle turnover project. This is the idea that what would happen if you could actually take these older vehicles off the road and replace them with cleaner vehicle technologies. What is the effect on air quality, human exposure, the health benefits that you would achieve? So this project is getting underway, and another ad for a session. Go check out the session tomorrow at 9, and you're going to hear more about this project from Dan Horton, the investigator that's been funded under this project, and actually more information as well. And then in the works, I'll just mention that we do have an RFA out on satellite-derived air quality data, and looking and trying to develop resources to estimate uncertainty associated with the data and the implications of that uncertainty for health research. And as we come to a close from this 2020 to 2025 strategic plan, I just want to mention it's been a lot of work. We published 25 studies during this period, and I just want to remind people there was a little thing called the pandemic during this time. So I really want to give a really congratulations to the investigators that accomplished all this work. There was over 150 peer-reviewed journal articles that were published from this research. So again, I want to thank the researchers, the HEI staff who are involved in overseeing the research, the review process, and the publication staff who helped dot the I's and cross the T's. And I'll turn it over to Anna now, who will talk about the Cherry program.
Thank you, Ellen. I'm Anna Rozovsky. I lead our Cherry program. It's Community Health and Environmental Research Initiatives program. We initiated our first set of studies this past year. They are all accountability studies focusing on the effect of emission reduction policies for communities experiencing persistently high environmental exposures. The 3 PIs are here, and they presented their posters yesterday, and I hope you had a chance to check those out. And Good Child is focusing on evaluating the distributional health impacts of local policy scenarios aimed at reducing vehicle emissions, and the location of that study is in Seattle, New York. Dan Horton, also funded under this program, is focused on improving emission estimates for heavy-duty vehicles in freight hubs and examining the air quality and health implications of adopting emissions reduction policies. And then Zhexin Zhang is creating high-resolution air pollution emissions inventories from tailpipe and non-pipe sources, and estimating the associated changes in health and monetized health benefits. The other thing that we worked on this year were guiding principles for engagement in study areas. This has been a long time coming. HEI prides itself on convening multiple sectors and prides itself on its funded investigators' ability in convening multiple sectors and strengthening and communicating the research. And so these guiding principles for engaging in study areas lays out principles for those activities. We worked on this document in collaboration with the Energy Program and with extensive input from the Cherry Research Committee and Council. And so we encourage you to check out that document on our website, and look forward to continuing our work. And I'll hand it over to Pallavi Pant.
Hi, everyone. Taking you on a bit of a world tour, as I tend to do in these presentations, you may have noticed that Ellen mentioned at the beginning, we had a component called Global Health as part of our 2020 to 2025 strategic plan. And over the years, as our work has expanded and evolved, we've rebranded it to Global Initiatives. That's also what you will see in the new strategic plan for 2025 to 2030. And since we met, last year in Philadelphia, we, as our other programs have been keeping busy, one of our major initiatives within global initiatives, the State of Global Air, which has the goal of tracking and communicating long-term trends on air quality and health impacts around the world. And we do this in partnership with Institute for Health Metrics and Evaluation. And in June last year, we published one of our global reports. This was the first since 2020, and we did it in partnership with UNICEF for the first time. And of course, some of the statistics from the report have already been quoted here, so I'm not going to belabor the point. But once again, using the data and the metrics, not just at the global scale, which indicate what a huge problem we have, but also at the national scale where countries are using some of this information, or at least some of this information is becoming a reason for countries to start thinking about air pollution. We do have a session following this one from global to local, so please join us there if you want to hear more about how some of these data get utilized. And we do have another report coming up in August this year that will be focusing on air pollution and non-communicable diseases. So if you have ideas of what we should be including or highlighting in the report, please get in touch. We also have regional initiatives both in South Asia and East Africa, and we will have posters tomorrow on some of the work from these two regional initiatives, to please check them out. But essentially in South Asia, we have been continuing our work on capacity strengthening in the region. We funded some research on cardiovascular health and air pollution. We are looking at changes in air quality since the introduction of India's National Clean Air Program, trying to see how the accountability framework can be helpful in countries like India. And we are also beginning some work with UNICEF as well as World Bank in the region, trying to look at how the available evidence, limited as it may be, can be utilized to inform policy, both on the environmental side, but also on the side of health systems planning. And then in East Africa, where we started working about 2.5 years ago, we've had an ongoing exercise in response to what we heard from the community in the region to look at and map out the evidence that's available. We published a report in April, so please check that out. Again, we have a poster tomorrow if you would like to see what we found, and my colleague Victor will be there to answer all of your questions. We've also been working in the region to strengthen the capacity of the local institutions that are working on air pollution issues. So we have done several convenings. And in the next phase, we are looking forward to perhaps funding some specific research studies, but also taking the link of, what the health impacts are to how can we monetize what these impacts mean, so that, again, we produce more policy relevant information that the local and regional, policymakers are asking for. That's been, again, a very specific request. So we're looking forward to continuing a lot of these activities. And once again, ours is a very collaborative effort. So if you have ideas or if you're working on any of these regions, I really welcome you to please get in touch. We would love to see how we can all work together to bring clean air to everyone. And with that, I'm going to pass it to Donna.
Good morning. I feel like first I need to thank Ellen for being willing to go first after Doug's talk. Thank you, Ellen. On a personal note, when you read Doug's book and you look at the results from the 6 Cities study, you'll see this dot at the top, Steubenville, Ohio, with the highest PM levels. I grew up right across the river from Steubenville, so I'm personally grateful to Doug and Arden Pope and all of their colleagues, and I guess it's no surprise that I ended up here at HEI. I will start with hopefully the energy slides, because I'm looking at global slides right now. In the next couple of minutes, I'm just going to tell you about a lot of work that we did to launch and implement this new research program at HEI over the time period starting in 2020. Next slide, please. Oh, I can click it. How exciting. Which one? The green? Thank you. Big green button. Thank you. Everybody else figured it out but me. Anyway, okay. Just a reminder, the goal of this research program was to improve the understanding of exposures, human exposures to unconventional oil and gas development in the U.S. This graphic shows the exposure pathways we started with, people's exposure to chemical emissions to air, to noise, and releases to water, both groundwater and surface water. I'm happy to say that with the help of a lot of people, we accomplished a lot of what we set out to do originally. And it was only possible with the work of the Energy Research Committee guiding this program every step of the way, the Energy Review Committee doing their rigorous job that HEI review committees always do. Also lots of briefings with industry and government officials and community groups asking us good questions that helped guide the work. And of course, our staff and our sponsors. So we've now funded a total of 10 studies. The budgets for these, by the way, range from about $250K to almost $3 million. So they differ radically in scope. But when we started the program, we were a little daunted by the speed of this development, the variation in practices among operators, the geological resources themselves are different, the environmental conditions in all these regions are different. And some said, how on earth are you going to study all of this and come up with something that's really meaningful and relevant to policy? And so the research committee set out to prioritize research that would cover multiple regions of the country, multiple types of operations, multiple types of oil and gas resources, all with the goal of saying, look, there's this tremendous variability, but what do we need to understand the most? What's going to be most important for making sure that we have the science we need for health protective policy around the governance of oil and gas operations? And so we landed in 4 major oil and gas producing regions of the U.S. in Colorado, New Mexico, Texas, and what we call the Marcellus region, Ohio, Pennsylvania, and West Virginia. Okay, and let me just start. I'm going to give you the briefest overview of the research that we funded, but also want to let you know that there's a session at 11 o'clock on this first item, the tracer collaboration. And then later this afternoon, 25 research posters describing the work funded by HEI Energy, as well as some really interesting projects external to the program around carbon capture. But the tracer collaboration really set out to monitor air quality and noise over the life cycle of a well. What's happening over the entire life cycle of the well, and the monitoring happened over a year or more, depending on the study. So really trying to capture that variability, not only of the operations, but the environmental conditions in each location. The monitoring data were coupled with the development of a tracer model, modeling emissions from very specific oil and gas processes and their impact on both local and regional air quality. And this was important because there'd been a ton of research that had been done before we started all of this, a lot of really good research, but it was hard to figure out where the contaminants being detected in air or water were coming from. And so these studies were designed to identify, to the extent feasible, the sources of what's being measured in air. There was also a separately funded effort through the NASA HEI program analyzing satellite data in the same locations over the same time periods, basically trying to look at what you couldn't necessarily detect from the ground-based monitoring, where there are hotspots or other things that might go missing from the ground-based monitoring that was happening with the tracer collaboration. I'd love to tell you results. I'm not going to tell you. You have to come to the session or the poster session. Also, as follow-on to this research, when we started, things were still really hopping with shale gas development, and a lot of changes, a lot of controversy. it's been around for a while now. It's been around since the early 2000s, and there's a lot of data that's been collected. And so as follow-on to the tracer work, the Energy Research Committee decided to fund 3 separate studies looking at those data and analyzing trends over the 20 plus or minus years since the beginning of the shale gas boom. And to the extent feasible, and this is tricky, but to the extent feasible, to what extent does unconventional oil and gas development explain any trends, and taking into account the fact that a lot has changed in how the oil and gas operators do their work and how it's governed across the U.S. Finally, water-related exposures. There are 4 studies. One is a 2-part study in Pennsylvania. And these studies were designed to take existing water quality data, pair it with modeling to understand what exposures might be occurring that are attributable to unconventional oil and gas development. Water is really tricky. As you may recall, there was a lot of concern around oil and gas impacts on water, but it's so hard to study, right? Because except for some cases where there are authorized discharges to waters of the U.S., water gets contaminated by accident, hopefully not purposely, but typically by accident. So how do you find that, right? And it costs millions of dollars to drill these wells. So we used existing data, and the result of this are some really terrific new approaches, including modeling, source apportionment modeling to distinguish UOGD impacts from coal mining, conventional oil and gas, fate and transport modeling that was used to assess the feasibility of connections between documented spills and violations at oil and gas facilities and observed contamination in community water supplies. And most recently, and as follow-on to some of this early work, regional groundwater quality model that's designed to quantify the vulnerability of drinking water supplies to spills that may occur around UOGD facilities. So we're very excited about all of this research and hope you'll join us to learn more about it. What's ahead? So Doug, thank you for referring to our strategic research plan. I mean, the details are really there, but we do hope to continue with this tracer modeling effort. We see it as a tremendous tool for both accountability research. It could be used in future exposure studies, health studies. And I just wanted to mention, this is last Monday, I read about a federal court of appeals ruling in Colorado. The 10th Circuit, I'm going to read it, the 10th U.S. Circuit Court of Appeals found that EPA's approval of part of Colorado's state plan to comply with NAAQS improperly allowed the state to not consider air pollution from drilling and hydraulic fracturing from oil and gas wells before production begins. I have no idea where this is going to lead, but it has implications for not just Colorado, but Pennsylvania and Texas and other states. And I'm pleased that with the research already completed, we've got some of the data that would be useful for that kind of assessment. And with the work going forward, we would have additional data to help with such assessments. We're also considering whether we should be funding work around produced water. And recently, our staff were contacted by EPA's Office of Water. They're doing a rulemaking on produced water. And the current administration has an interest in looking at changes that have happened in treatment technologies for produced water and determining whether there can be more flexibility on its beneficial reuse. The phrase is beneficial reuse for things like agriculture, cooling water to power data centers, AI data centers, and that sort of thing. So we are exploring where we might add value to that kind of decision making. We're also looking to expand our scope to other forms of energy, and we're working hard to think about the development of or develop a multi-sector collaboration to develop a systemic framework for assessing our energy choices and thinking about health as we do that. And I'm going to end with just our very first project along these lines with funding from Breakthrough Energy and oil and gas industry. We just started a project to develop a technical approach to assess health implications of a proof of concept industrial efficiency case study. Ellen Mantis is working with us on this. This is a cross-sector project. And our goal here is to look for a case study of an industrial efficiency project where they endeavor to reduce emissions to air, reduce releases to water in a way that's going to benefit health And what we want to do is document that. We want to actually quantify and predict what the health benefits may be, ideally go back afterward and measure those health benefits. And we are choosing a case study with help of a tremendous expert special panel that is one that can be, if successful, be reproduced widely so that that health benefit can be reproduced widely. So we're excited about this project, and hopefully we'll be reporting more to you next year on that. And with that, I thank you all. And I think we're all happy to take questions or an early break, whatever you choose. Thank you.
I know that was a lot, and I see Chad walking. Not yet? Okay. I know soon he'll have a question. Questions from the audience. I know we've thrown a lot at you in the last 30 minutes or so. I think it reflects the broad scope and depth of work that we undertake at HEI. And, you know, we're really proud of what we've accomplished over the previous 5 years and looking ahead within the new strategic plan. So we're very excited about, you know, the road ahead. Okay, see, I knew it.
You asked for questions long enough. I'm not sure if I'm able to go back and ask Doug Dockery questions, but and this is a kind of a difficult question. You mentioned that there were people who criticized your work, Suresh Mulgavkar, Roger McClellan. And this is sort of a sad question, but are you aware of anybody who criticized your original work ever through scientific inquiry and investigation changed their mind? And if so, what were the things that actually caused them to change their mind?
Well, I mean,
Or vice versa.
I mean, let's be clear. I mean, we welcome critiques. I mean, that's the whole process of scientific investigations, is to critique the science that's out there. And I think one of the characteristics of epidemiology is we critique our own work. And, you know, we often say that epidemiologists eat their own babies because we critique our work more than anybody else and put that in our papers, and it provides then the pathway for other people, the opponents, to come in and pick up on those critiques. So, I mean, we welcome this and really look forward to having, I mean, that's the way science advances. It's by disproving hypotheses. So this is a very important process. And, you know, I'm not suggesting Roger or Suresh, you know, had any ulterior motives here. They have different perspectives, and we're trying to advance the science by doing this. So, I mean, as you see, if you look in the book, I mean, we talk about many of these criticisms, and now, I mean, these are legitimate. What is the basis for what is the biological basis for these observations? I mean, it didn't make sense to us, and we changed our mind over time. We originally thought, when we started the Six City study, the title of that study is The Respiratory Effects of Respirable Particles and Sulfur Oxides. This was totally a study of respiratory disease. And the findings for mortality were a complete surprise to us. And when we began to investigate that further, it was not respiratory mortality, it was cardiovascular mortality. And, you know, there were dead ends. There were, Arden and I did several studies trying to look at different health effects that were complete busts. And you publish those. And so it's, you know, I guess our goal in writing this book was to help, you know, actually the young people in the audience here understand that this is not a straight line. That, we started 30 years ago and it was a straight line to get where we are today. There were many, many twists and turns. You can read all the individual papers, but what you're missing is the context of why, we went in this direction, or, who came up with this other idea, or how it all works together. So, we were hoping to provide the context and the history. And I think we were successful. The feedback we've gotten so far has been very positive, and we want to make sure that story was told. Is this for me or?
I think for you. So, hi, my name is Behnaz. I'm from McMaster University. So, one question pop up my mind after Shad's question is like, I have read many reports like HEI and other studies, but I'm still not sure like when the studies adjust for diet, they didn't explain how they adjust for diet. Like it's a whole complex thing, and especially in terms of like air push effects on obesity, on cardiovascular disease, on metabolic syndrome. It matters a lot, like what you eat and what's the composition of your food, and what it's not just calorie intake. It's more of composition that's changed the glycemic index and like fat deposition, and also the physical activity. They like mention, yes, we adjust for physical activity, but how much adjusted? Like, what's the duration that you like? It's something like air pollution. You don't know if somebody walks 3 days a week or somebody walks 15 minutes in one day and 30 minutes another day. And if you adjust in these models, sometimes you say it's an over adjusted. So how we counter for that? Because this is an important thing that affects the outcome.
I mean, that's always the question about what are the other explanations in epidemiology. And unfortunately, we don't have the tools in epidemiology to separate out these. And we have to, depend on statistics, but also very clever designs to try and tease these things out. And I think, we've depended on trying to find these unique situations. I mean, for example, the Utah hospital study that Arden did was one of the most brilliant studies. It's how I got introduced to Arden, where we had a situation where the steel mill workers went on strike and closed down the steel mill for 12 months, and air pollution improved. And this is what we've always wanted to do. What happens if you just turned off air pollution, hopefully didn't do anything else, and see what happened in terms of health? So if you can find those unique situations, and presumably people are not changing their diet or changing the other factors, then that provides you with some real insights. But in general, we have to depend on statistical analyses and new insights. And I mean, I was so impressed yesterday in the discussion about artificial intelligence. Is that? See, it doesn't work for me. I could use, my intelligence is limited. I could use any type of intelligence that came along. But I mean, the new methods that are being developed that help us understand this and really add new data into this. On the other hand, it has to be based on understanding of the mechanisms and, based on, basic fundamental principles. And I still remain a little skeptical about just throwing all the data into some kind of massive analysis and seeing what comes out. On the other hand, it's been remarkable in what's been exposed. So my premise, I think both Arden and I have always worked on the premise of follow the data, see where the data leads to you. What is the evidence? And we have to depend on really clever designs to try and answer, these legitimate questions that are raised about alternative explanations. So we're depending on, the new wave here of investigators who are going to be able to address those questions.
Thank you.
Any other questions? Yes.
Can you hear me? Yeah. So I was really impressed with, Doug and I, of course, we're looking back a little bit and stuff, but, and we love Dan Greenbaum, we love what's been done by, what HEI has done in the last 20 years or so. It's been just wonderful. But now we're looking at your moving ahead, and it's pretty impressive to me that you're not looking back. You're really looking forward to some of the problems that we're facing and trying to get on top of those. Could you give me a bit of better idea of how you're finding those, how you're making those decisions in terms of what's the important thing to understand in the future, and especially in the atmosphere of people being critical of this approach and not wanting to fund it, not wanting to sort of support it in the long term.
Donna, take a shot. Oh, I thought you were.
I'm the technologically oh, it's on. Okay, great. So I alluded to it a little bit. I guess I'll give an example. We've hosted a series of research planning workshops, usually around a particular topic. But when we do that, we bring tons of people into the room. We want everybody from government and industry and NGOs and the local communities that are going to be affected by it, the researchers who are studying it. And we structure these events so that people can hopefully speak very openly. We write summaries, but we don't attribute anything to anybody. But the goal here is to get everybody's honest assessment of the science that's needed and the science that's not needed. And then particularly where HEI is uniquely suited to provide the information that could be helpful to policy. We want to stay in our wheelhouse. But the short version is, we talk to a lot of people and we do it repeatedly over time, all of the programs. And if we haven't talked to you and you think we should, please be in touch, because we do want to hear from everybody.
Yeah, I'll just add that, I think this is one of the most exciting, I'm sure every scientist says, think of all the things that we could do in the future. But if you were listening to that panel on artificial intelligence, I had no idea that the past 20 whatever years of my carrying my phone around is gonna, potentially end up in somebody's analysis, right? And the power of that just to me seems to be amplified to a degree that we've never ever seen before. And so I think that, while the answer is we need more science, like it truly is, we need more science. The reason, because we have more data, right? And how do we interpret it? How do we analyze it? So I find, that particularly compelling and interesting. And that's where we want to be as HEI. And we want to be the facilitator of conversation across sectors and everyone, contributing to what about this, what about that, and not honing in on an answer, if you will, or the result. What is the result supposed to be? There's nothing like that. Let's figure out how we can answer this question that we have, and how do we get there. Go ahead.
My name is Sherry White Williamson from the North Carolina Conservation Network. Thank you, panel, for your presentation. Thank you also for the research on hydrofracking. I'm wondering, are you beginning to look at biogas? We're seeing a lot of proliferation of justification for animal waste and how it's being disposed of, but there's also a huge impact on communities that live around those facilities. Is there any thought being given to look at states that have concentrated animal feeding operations and these huge cesspools that result from the way that they're storing the waste and then getting rid of it or trying to justify getting rid of it.
As of right now, that's not a topic that's been discussed among the Energy Research Committee. On the other hand, there's a whole bunch of them sitting in the audience hearing what you're saying. So happy to discuss it with them and happy to talk with you more about the details and the particular challenges that you're confronting there.
Thank you.
Hi there.
Gunnar Schade, Texas A&M. Thank you very much. It was a very nice overview. One thing that was not mentioned, and I feel like it's a bit of a elephant in the room, funding is going to go way down. At least it's threatened to go way down. And I wonder how HEI has thought about this going forward in the next few years, especially as the reduction in funding comes along with strong hostility to science.
Yeah, we haven't thought about it at all, actually. No. Yeah, of course, right? I mean, that is the question of the moment, right? Not just for HEI, but for every NGO, every university, every state, anybody who is involved or related or benefits from, support from the federal government, which is literally everybody. I will say that, HEI has had a unique funding model for 40 plus years, and that is support from EPA as well as from the auto industry and other sponsors. The support from EPA actually comes not just from Office of Research and Development, but also from Office of Air and Radiation. So there's not just, one pot of funds at EPA that supports our work. We obviously are, the organization or the agency is going through a reorg, which we heard about I guess it was reported in the news on Friday, and we're waiting to hear the outcome of what that reorganization looks like, and in terms of what that means to organizations like ours and others. I guess we have not heard anything directly from the agency regarding our support, so we are I think cautiously optimistic that with our sponsors and the long partnership that we've had, that the value of the work that we do here will be recognized. We did have our grant renewed under the first Trump administration, so there is precedent, if you will, for support for HEI, even in the context of a prior Trump administration. So. But again, the HEI has never been about Republicans or Democrats. It's been about government and private sector, right? And there's no R's and D's in that. It is what it is. And so we continue, that is the plan, to continue moving forward in that way. We all, you're not going to stop science. At the end of the day, science is going to give you information, right? And whether you pick it up and use it to make decisions about policies and so forth, that may be up to the administrations, but at the end of the day, we are all, subject to science. And so it makes sense to continue working together. I think that HEI, and obviously I've had many people over the years tell me about, we can't think of any other model like HEI's. And it's true, right? When have you ever seen an organization that has benefited from this kind of a collaboration and this kind of a partnership, where there's really neutral ground to come in and hash out questions regarding literally the important science of our time. Now, I will say that Doug's comments, I can't say that we do that in a very fast way, but we do that, right? And we have those conversations, and we solve problems. We provide information that is useful for those who are making decisions. And that is our plan. That's our mission. And that is what we're planning to do for the next 5 years and the next 5 and the next 5. So yeah, I wish I could give you more, specific information about what happens on what days and so forth. I think for now, we are looking forward to implementing the plan that we all collectively, the HEI network of our sponsors, have put together and for the benefit of society. I mean, that ultimately is what we're trying to do here.